Hi, I'm Matt, and welcome to the Strong and Healthy Rehab channel, a place to discuss all things rehab. In this video, I'm going to talk about the reasons why someone would say physical therapy didn't help me. People will typically say this if they didn't get the results that they wanted. Now, in healthcare and in medicine, unfortunately, not everyone gets better. Sometimes it is due to something that they may have a control over, but other times it's because of something that they had no control over. Keep in mind, each person's experience is their own, and just because someone else had a negative experience doesn't mean that you are going to have the same type. Now, let's get into the list of reasons why someone may not do well with physical therapy. The first reason that we will talk about is that the condition the person has wouldn't respond to physical therapy in the first place. In healthcare and in medicine, it is very important to match the proper treatment to the condition that somebody has. Think about it like this. If somebody has the flu, they need a medication designed specifically for that flu virus to treat them. And if they are given a medication for anything else, it's really not going to help them. Same thing applies for physical therapy. Now, there are some conditions out there that physical therapy isn't really going to benefit. However, we'll talk a little bit more about how physical therapy could help somebody in these situations. Say somebody has an infection or a fracture, they have cancer, maybe they have a condition going on that is threatening their life or a bodily function, or maybe even a psychological issue that is producing pain or a limitation of some sort. Often with these patients or somebody dealing with something like this, they wouldn't respond to doing physical therapy. Take, for example, somebody comes in with back pain, and through the examination, this person has a fracture in their spine. Well, of course, doing physical therapy for that is not going to help them. Likewise, if they are having a kidney infection and that's producing back pain, well, yes, of course, that's not going to treat it. Or even with this back pain, colon cancer can produce back pain. Or even somebody has something such as a cauda equina, which means that there is a disc bulge coming out so far it's compressing some of the lower levels of the spinal cord, and that's causing causing a possible loss of being able to use your bladder or your bowels. So yes, we want to send that person off to get the proper treatment. Now, I will say, often these patients can benefit from physical therapy for some of the side effects of these conditions. Say somebody is hospitalized with an infection, they can become very, what we call, deconditioned and weak. They may need to do a little physical therapy to get their strength up. Likewise, somebody has a fracture. Once they've healed from it, they could have a loss of function. So yes, we want to work with that person and get them better. Cancer as well. There are physical therapists who specialize in working with people who have cancer or maybe had cancer in the past and they're dealing with the side effects of that. And like I mentioned, psychological issues. People can have pain manifested from any kind of psychological issue or something like that. So doing physical therapy with somebody, moving and exercising can help them get over that. So keep that in mind as well. If someone says physical therapy didn't help me, well, they may have had a condition that it wasn't going to respond to physical therapy. Another reason could be that, yes, the person had a condition that would benefit from doing physical therapy. However, the treatment that they received was not lined up or correct for the condition that they had. Now, in a previous video that I'll link below, we broke down how all physical therapy is different. And there are a number of reasons why it is different. And that means that the treatment that you receive for a condition needs to line up what is best for that condition. Now, all of us as therapists, we have our strengths in certain areas. We have areas that we like to specialize and focus in because we are just, like I said, we found that we are very good at doing that. And I'm not saying that somebody's going to get a bad treatment if they see a therapist that maybe doesn't have that area of focus that they have going on, but it may not be exactly what they need. A couple examples. Say somebody had a stroke. Typically, after someone has a stroke, they deal with some weakness and inability and like on one side of their body. Well, if they decide, hey, I'm just going to go see this therapist over here, but this therapist is a specialist in children, that person may not respond quite as well. Now, they may get adequate care, get taken care of, and gain some function back, but they may not reach all of their goals just because that therapist is, their strength is working with children. So if that patient had seen somebody who worked in neurology and saw people with, strokes, they would have done much better. I know for myself, I get patients that come to me that have shoulder pain or maybe knee pain, and they saw another therapist or they saw somebody and they said, yes, I did all of this therapy. I really, really focused in this area and it just didn't get better. Now, with my specialty is in the spine, so we may look at their spine and find out, the symptoms are coming from your neck. They're coming from your back. And when we focus our treatment there, they feel much, much better. So we just lined up the treatment to the condition that they have. Now, this is not, again, to talk bad about other therapists. We all have our strengths. And just like in any other profession, we have those areas that we are better in. Now, I will say sometimes people can be limited in where they go for care. There can be just a few clinics in the area, just a few clinicians in the area, and someone is just, bound, hey, I just have to go over here. This can be managed at time. With technology, we do have the thing called telemedicine or televisits. So you can find therapists from all over the country who specialize in different things, and they may be able to treat you themselves or direct you to someone else who could help you much better with that condition. So again, if somebody says, well, therapy didn't work, did they receive the proper treatment for the condition that they have? A major area that is a big, big limitation to so many people, and this is something that is so frustrating to us as therapists and healthcare providers, is that insurance, the health insurance that people have, can limit them in what they do. Now, in the United States, many therapists and health practitioners practice within the insurance model. There is another video that talks about what's the difference between a clinician that works in the insurance base versus the cash pay. And a health insurance company is a business, and businesses want to turn a profit. They want to make money. They don't want to spend a lot. And we as providers, when you go to see us, that is an expense to them, and they want to limit that. So one thing that a health insurance company can do is they can just, like I said, limit the number of times that you can go do physical therapy. Some health insurance companies may say, okay, during the calendar year, you only get 20 visits of PT. And that doesn't matter for whatever that you have. You could have an issue that goes on in January, you need PT, and maybe one that happens in October. And whatever that you used up in the beginning, you don't get more for the next issue. Another thing that they do is that they approve visits based upon the condition that you have. And so when you come in to see your therapist, that we write up that evaluation and we send all that information to them and request a number of visits. The health insurance company really just reads that. They don't take into consideration you as a person. They just see this information there, and they make a determination on how many visits that you need for that condition. And they'll just send it. Again, they don't take anything else into consideration. They just say, hey, well, your shoulder hurts. Okay, you get 12 visits, and that's all you get. And we know as clinicians that sometimes it may take more. There are a lot of other factors, which we will talk about here in a bit, that play into somebody's issue about why they are having it and how to get them better. And we may need more than 12 visits, but that health insurance company say, nope, that's all we're going to pay for. And it can put you, the patient, at a disadvantage by saying, well, I'm stuck with that because I can't pay out of pocket for it. So it can really, really limit it. Now, this is something that we are fighting as providers, so not just physical therapists, but also physicians, nurse practitioners. They're all getting on board with this because we want you to live your best life. We want you to be healthy. So either one way that they are doing it is places are just going cash price, saying, hey, I'm just eliminating the middleman. I'm not going to see insurance, and just do whatever it is best for you to get you better. Also, we have our governing organizations that do talk with the government representatives. So your representatives in Congress and the Senate, to let them know, hey, these are the things that we are dealing with that's limiting our ability to practice. And we often ask you, patient, to help join us in the fight because, again, this is something that limits you in your ability to do the things that you want to do because you're dealing with pain or a limitation, things like that. So, of course, you can talk to your therapist to say, hey, how can I help join you in your fight? And I always recommend to everyone, do a little research on this, look up some stuff, and find out about that. But, like I said, this could be another reason that someone didn't do well to physical therapy because their insurance said, nope, you only get this number of visits, and they need it more. So, unfortunately, they didn't get better. This reason, I will say, may be a little bit harsh, and I want to warn you about that. But if you ask any therapist, what is the difference between patients who get better and patients who don't? They will tell you the patients who don't do their exercises at home, who cancel or don't show up for their appointments, or don't push themselves in their therapy sessions are the ones who don't get better. And just like with anything in life, it comes down to being consistent and putting the work in, and that's going to get you your best results. Now, this is an example I like to use and talk to people about. Say your child comes to you with their report card and they're failing a subject. What's the first question that you're probably going to ask them? Are you doing your homework? And if the child says no, well, I'm not doing the homework. Well, duh, you have to do your homework if you expect to do well. That homework is just like the home exercise program that you get. We ask somebody in school to do homework so that they do well in the class. Well, we ask you to do exercises at home to help you. If the person says, if the child says, yeah, I'm doing all the homework, you may ask, are you going to class? That can be a big thing. So yes, are you going to your therapy appointments? Because people that, again, don't do well, they're known to just cancel and they just don't show up. They're always rescheduling. They're always bouncing it around. And lastly, you may ask that child, are you putting in the work? Are you asking questions? Are you paying attention? Are you participating in class? Likewise with therapy, yes. People, you have to push yourself. You have to do those things. Now, I will say this gets into a little bit of a kind of a psychological self-help type deal, is that we often want to blame things outside of ourselves for something that didn't work for us. It's way easier to blame somebody else or something else to say, oh, it's their fault, it's this fault because of why this happened to me. But look at what successful people say. And it doesn't even have to be like the super, super rich, successful people, but anyone who achieves something. And many of them will say, the biggest things that changed for me are when I started taking responsibility for myself. I quit blaming others and I took that on me and I did the work. And I will say, as a physical therapist, therapy is hard. It is very hard because you're coming into us. You're not feeling well. You're taken out of your normal routine, your normal life. And it can be hard to do those exercises and to do those things because there may be some level of that's uncomfortable. It could be easier to just want those feel-good things, but it doesn't get you the results that you want. And if we want to get the most out of it, you got to show up and you got to put in the work day in and day out. And I can almost guarantee you that if you come in to all your appointments, you do your stuff at home, like I said, you show up, you put that work in, you're more likely to do better. And if you don't do better, I will say this, those patients that, hey, I did all the work and don't do better, it lets us know, hey, physical therapy was not going to help you. We can move you to the next thing that is going to help you. So if somebody again says, well, physical therapy didn't work for me, you can ask them, did you actually put all the work in? Did you push yourself to do it? You may be surprised with what some people say. Somebody's health can have a major effect on not only how they respond to physical therapy, but also any other medical treatment. Most people who don't do well with physical therapy have other medical conditions going on as well. So they may have something such as high blood pressure, diabetes, and autoimmune disease. Maybe they don't have healthy habits such as proper nutrition. They're sleep deprived. They're just inactive or overweight. This makes it much harder for somebody to overcome something such as a pain or a loss of function because of these other health issues. So take, for example, if we have two 50-year-olds that come in, same age, they are very similar in almost everything, but one of them is very active. They exercise every other day. They eat relatively well. They don't take any other medications for any other health conditions. They're more likely to get better faster compared to somebody who has to take several different medications for chronic health disorders. Maybe they don't eat well. They're 50 pounds overweight. They don't exercise. They're more likely to not do as well because it's going to take longer and it's more things that kind of get in the way of getting them better. If you want an example of this as well that's out there, look at research. A lot of healthcare research is done on individuals who are in the, as we say, healthier, so that they are, they don't have a certain BMI, so they're not too big. They are typically between a certain age range. They limit the number of other health conditions that they have, or they can't take certain medications. So they look at these relatively healthy people, but those often aren't representative of people that we interact with. We know many people who may take medications for stuff or have other health conditions. And like I said, this is something that really can get in the way of helping somebody achieve their goals with physical therapy because, think back to what we've already said. It may take them longer, and if we have these other limitations and things in there, that can hamper their ability to get better with therapy. One thing that is not really spoken about a lot, but has a big effect on somebody's overall health and how they respond with really any kind of health treatment, is something called social determinants of health. These are things such as economic, social, or environmental conditions that influence somebody's health status. And these are often very intertwined with one another. They can also be at varying levels of influence. So some of them may be high, some of them may be low, but they all have an effect on how somebody can respond to something like physical therapy. And let's dive into them. The first one we'll talk about is an economic determinant. And that includes somebody's job, their income, expenses, and debt. Now, it has been found that people who are at a lower income level typically have a poorer health than people at a higher level of income. Now, the level of income does vary. If you ever want to look this up, it does vary because the cost of living is different all across the country and all across the world. So somebody may not do well with physical therapy because they may have a low-paying job so that they have less money coming in to pay for their needs. Or maybe somebody does have a good-paying job, but they have a high level of expenses or a lot of debt that it limits their available income. And this can cause a level of stress. Now, all these things in social determinants of health do cause a level of stress, and stress can affect health and how somebody responds. So it causes this level of stress in where they choose to spend and where to spend their income. So if somebody's dealing with an issue They may be having to choose, where do I spend this money? Do I spend it on the copay, or do I spend it on paying on this debt or paying on my rent? And this can be a very hard choice for someone. So somebody could end up giving up doing therapy to focus on something else that is of an economic need. Education is one. And now education includes somebody's educational level, job training, language abilities, and even their literacy level. And this can be all over the place because somebody's formal schooling doesn't always determine how well somebody's understanding is. Someone can have a very, very high level of education, but a very low level of literacy when it comes to health. Likewise, somebody may not have reached a very high level of schooling, but have a very, very good understanding of things that are explained to them. Now, I will say there is an issue that comes up in healthcare is that often some of the forms and handouts that people are given are written at a 10th grade reading level. So that's a pretty high reading level. But most people only read about a 6th grade level. And this means that it's very hard to read and understand them. Also, unfortunately, and this happens, providers may use medical jargon. They use medical terminology and medical words when they talk with somebody, and it can be difficult to understand if you're not familiar with them. And people that, the patients that we deal with don't want to appear as they don't understand it. So again, with those forms, I don't want to appear that I don't understand what this form says, or I don't want to appear to not understand what you're telling me. So they just agree with whatever because they're face to face with the provider, and they don't want the provider to think they are dumb, quote unquote. But this can really hinder somebody with doing physical therapy because they don't understand what they are doing. So the therapist may have explained these things to them. They just nodded and said, oh, yeah, but didn't have a full understanding. And they didn't want to tell the therapist about it because they didn't want to appear a certain way, or they just went about it. So keep in mind, it's not always just someone's, when we talk about education, where they achieved in school. It can just be their understanding overall of what is expected of them to do or the expected outcomes, things like that. A person's social network is another determinant of health. We are social creatures and we need interaction from other people. And if we lack this, it can really affect our health. And this is a big thing that comes up when someone is dealing with a loss of their normal function. They may lose that social interaction that they once had. So, such as, I don't get to go out and do these things in my community or places I like to go, such as saying, well, I don't get to go to church and see people there, or maybe I don't get to go to work and interact with my coworkers, and they miss out on that. This also can include relying on support from family or friends. And because they have this loss of function, they need their help to do things. It may include doing things like around the house, so like cleaning, cooking, going to get groceries, cutting the grass, that they can't do that. They have to rely on someone else to do that. Maybe it's just having them drive them somewhere to go to appointments or different events. It could even be personal things like getting dressed or bathing. And if they have possibly someone in the home that refuses to help them, or they don't have someone, it can have a very negative effect on them. So take, for example, someone dealing with a stroke. They can't drive or do those simple tasks around the house that they once did. They have to rely on someone else. And if they have someone there that can help them, it's less stress on them. Now, another thing that is important with this is that they also need the people around them to validate the issues. You wouldn't believe how detrimental it is to somebody when a patient's family member or a close friend tells them something like, oh, you're just milking this, or I've never heard of somebody going through this. That has a very negative effect on somebody, that the person that are close to them don't believe them. They're not validating what they go to, and they lose that social connection. And it can lead them to having a poor effect in improving their health. So keep this in mind. If someone again says therapy really didn't help, Maybe they didn't have a very good support structure around them while they were doing therapy. Food is another one. So it's not only the ability of having food, but it's also accessing food. It can be a really big hindrance to somebody's ability to recover if they don't have something to eat, because it causes a lot of stress. If somebody has an injury or a surgery, they're going to need additional calories to heal. Also, it can be very hard for some people to get food, either due to a lack of money, like we spoke about income earlier, or transportation. They're not able to go and get food. Also, we have these things called food deserts, where people may live in a very densely populated area, but they don't have access to good quality foods. Instead, they're having to go to places like gas stations, convenience stores, fast food to get something to eat. So it can be a very big stressor and a detrimental, have very detrimental effects to someone's health, is to have the ability to not only eat, but have the ability to go get that food. And that can really hinder somebody with doing therapy. The last one we'll talk about is someone's environment. This includes their housing situation, transportation, their physical environment, and their safety. With housing, we all want somewhere to go. We want to be provided with shelter and comfort. And it can be very stressful for someone if they're having to constantly move, if they're unsure where they're going to be living at any point. Also, transportation is a big one. So not everybody has reliable transportation. That includes both personal and or public transportation. If you've ever had a car that was prone to breaking down, you'll know about that sense of worry about being able to make it wherever that you're going and be able to make it back home, because is the car going to make it? Same goes for public transportation. Not everyone lives somewhere where public transportation is, one, available, or two, reliable. And that can make it very hard for someone to get around. Also, physical environment. That's a big one. So think about it. If somebody happens to live near a very busy industrial area, it could be very loud and very bright around the clock. So there's a lot of trucks or machinery. There's lights all going around. And all that noise and light can make it hard for somebody to relax or even sleep. And on top of all of this, throw safety in. We want to be safe. We want to be safe where we live. We want to be safe when we travel. And if we feel that our safety is a threat in any way, we're going to be very, very stressed. And all of this can lead to worse outcomes with therapy, but also, again, has those detrimental effects to someone's health. There you go, everyone. That's the reasons why somebody may not do well with physical therapy. So if anyone ever happens to say that, physical therapy, it didn't work for me, keep in mind, it may have been something there about a reason why they didn't get better. Could have been that the condition that they had wasn't going to respond to physical therapy. Maybe they didn't get the right treatment for the condition that they had. Maybe insurance cut them off too early. Maybe they didn't push themselves. Maybe their health wasn't very good overall, and again, that they needed a lot more work. Or it could have been any combination of those social determinants of health. Could have been their economic status, their educational status, could have been environmental, food, social connection, any of those. Could they've had something along those lines? But like I said, keep in mind, physical therapy can help so many people. Maybe not with the main condition that someone has going on, but if you're dealing with a loss of function, that is something that is limiting you in doing something that you need to or want to do, physical therapy is a very, very viable option to help you reach your goals. Thank you for tuning into the video. If you enjoyed it, please hit that thumbs up button. If you have a question or comment, drop them down below, and please consider subscribing to the channel, because all this information that is provided is to keep you strong and healthy.